So welcome back to a very special episode of Walkin Talkin with Tim. So today's guest, as you can see, is Amy Mansue, the president and CEO of Inspira Health Network.
Thanks for having me, Tim.
And thanks for being here. So let's jump right in. I wanted to have Amy on because there's a whole lot of folks that are confused right now. Everybody is just wondering, what do I do? Where can I go? How can I go? And should I wear a mask? Should I do this? So it's masks, mandates, and vaccines is basically what we're talking about. So I wanted to just throw it right to Amy and say, look, people are confused about whether or not they need to wear a mask, depending on where they go, because laws are different in Jersey and Philly and Delaware and all different states.
Right.
And then, people are confused about, should they get the vaccine? Shouldn't they get the vaccine? What should they do? Where should they go? Most importantly, in my opinion, is where should you go for the best information so you can make a really good decision for yourself? I'm vaccinated. I know, Amy, you're vaccinated.
I am vaccinated.
So what do you think?
So I would say that, look, we've all been preaching about trust in the science.
Mm-hmm.
We know that the vaccines are indeed safe. We know that they are the single greatest thing you can do to protect yourself from this terrible, terrible virus that has just taken thousands of souls. So for me, it was an easy decision because I've seen up close what it does to people. But for other people, it's not going to be that easy. They're going to think about, I'm young, I want to have kids, what's it going to happen? For some people, they just don't believe in vaccines at all. They never had a flu vaccine, so why would they get this? And what I would say to people is talking to your physician or your trusted healthcare provider. Sometimes it doesn't have to be a doc. Sometimes it's a nurse that you is a family friend. Ask them. They know you. They know what the risks are. And while I can easily say everybody should get one, it is a personal decision, and you're going to have to make that. But it is not a decision that is made without risk.
Right.
So if you say I'm not going to get vaccinated, you need to understand that the one thing about the vaccine, some people will say, well, it doesn't cure me. I still could get it, but how you get it and what happens to you will be significantly less damaging than if you didn't have the vaccine at all. And that's really important when it comes to COVID, because what we've seen is it impacts people all different ways. Healthy, strong people all of a sudden get wiped out, and they end up with what they call a long haul syndrome. Long hauler syndrome, that's what it is. Where you never can stop feeling, tired and exhausted, and it's tough. And, then of course there are those people who didn't make it at all. And that's just the crushing part of it. So many people have died. And what I say is, sometimes you couldn't help it because we didn't know, but right now we know. We know that you wear your mask, you wash your hands, you stay socially distanced if you're not vaccinated. And what we really want to say is make sure you get the vaccine.
What about the state-to-state stuff?
Yeah, so here's the thing. We know this, right? States' rights, the basic constitution, the local areas get impacted differently. And so you want that local control. Look, I'm from Jersey, man. We love local control. We all love our mayor and our towns and our school districts. And it's the same thing with healthcare. And so make sure you know where you're going, make sure you know what the rules are. Obviously, now is a difficult challenge because Dr. Fauci has said, no, you don't have to wear a mask in some situations. And, not all the governors are there yet. But
right, the CDC saying one thing, and the states are all saying something different,
and they're doing that based upon what their own infections rates. That's what they're looking at. We got a fan club here.
Hey.
They're looking at their own infection rates, and they're making those decisions. So in New Jersey, we're seeing that 70, what's the number, Tim? Help me with this. 70% of New Jerseyans got their first dose.
Oh, yeah.
And that's great. But what we're now seeing is people aren't showing up for the second dose. So
which doesn't really make any sense.
If you got the first one, just go back and get the second. It makes it easy. And I'm proud of the folks at Inspira. We've given 90,000 doses. And the team there has just done an incredible job. But we've pivoted now. We're not doing it at our big sites anymore. We're going to schools. We're going to local community centers. Because for those people who aren't going to come to the hospital, you got to go to them and make it as easy as possible. So that's what we're doing.
Let's take a quick look. Let's give a shout out. Shout out to the Woodbury Heights Fire Department. Is yelling at us as we're going by. Hey!
Very fun.
So good stuff. And then there's Dot's Ice Cream. You asked what
Yes,
the best
I
ice
did.
cream was, right?
You told me chocolate mint.
So Amy came all the way to Woodbury Heights to walk around the neighborhood so that we could have this conversation, so that kind of enlighten everybody. Listen, I don't know. I would never tell anybody what they should do. That's not my goal here. My goal here is just to say, look, my concern is that people are going to Facebook for the news, going to Facebook to find out, should I get vaccinated, going to Facebook to find out, should I wear a mask? I don't think that's a good idea. And I said to Amy a little while ago, I said, I think the best place to go is your doctor.
Absolutely, without a doubt, because your doctor knows you. They know, and if you don't have a doctor, then call one of us. Whether it's Inspira or Kennedy or
Not me, her.
But we all have primary care doctors that we want to connect you with, and it will make a difference to make sure you have that trusted authority. We also have our websites, each of the hospitals, and I would also say that, Tim, probably something people don't know, is all of the hospitals have worked really well together to make sure that we get you the information you need and get you the vaccine and take care of you. And every time the situation changes, we just pivot and say, okay, here's the new set of rules. We're going to do what we need to do to make sure our communities are safe.
I don't think it gets any better than that. So I guess at the end of the day, the best thing to do is to reach out to a healthcare professional is what we're getting at, right?
That's my advice, Tim. The other thing you asked me previously as we were walking and talking was, how do you feel as a healthcare provider? Do you think everybody should be staying inside?
P.S. I made her walk like 5 or 6 miles.
It's all good. What I'll tell you is our local businesses have to be open. We have to support the economy. And that's why whatever it takes to get back to whatever normal looks like, we got to do it. Because if people don't have jobs or aren't getting paid or businesses can't support their local community, that's crushing.
Yeah.
And it's a balance you have to make between the public health as well as the need to make sure that we support our economies.
Exactly right. So if you were to tell all these viewers, any viewers that we have here, where to go to get their information, let's stop for a second because there's water coming at us right now. So we're having all kinds of fun here right now. But should we spin around and show them? Look. So if we go that way, we're going to get soaked.
That's okay.
So what would you tell people? Like, where would you tell them to go? Like, do you have a website?
I do have a website. So our Inspira website provides all that information. I go to the CDC website is what I check periodically just to make sure we're in charge. The state's website, the covidnj.com,
Right.
that is a really important up-to-date information. And while you busted on it, I'll just say, there is a lot of information on Facebook that comes from reliable sources. So you can go to the CDC website. You can go to.
Well, that's different.
Yeah, but they link you there because they know that that's what
Right.
people are reading.
That's a trusted source, though.
Yes, it is.
That was a great term we made back there, by the way.
I know.
While videoing, by the way.
Very smooth.
Very smooth.
Very smooth.
Anyway, so listen, if you need information, you want information, Amy just pointed out where to go to get the information, especially if you are unsure of what you want to do. And look, at the very least, reach out to your own physician, your own doctor, and just say, hey, what do you think?
Hey, Tim, just one more thing I would say. It's safe to come in and get care. We are seeing people that have delayed getting care, that they know something's wrong and they just try and ignore it. It's really, really hard if people end up being much sicker than they need to be. And the reason I say this so seriously is we saw that our breast screenings dropped by 50% in 2020. That doesn't mean that cancer went away. It just means that people stopped getting screened.
Right.
So please make sure that you're taking care of yourself. Get your annual physical, or if there's anything wrong, just call, reach out, let us help you, because it's not going to get better anymore.
And Inspira does a great job. I was telling Amy that their local office keeps calling me because I'm due for an appointment, and I think I've gotten 3 phone calls and a letter saying, get your butt in here and get checked out because,
we're worried about
your
you.
blood pressure, young man, gotta get
That's
that checked.
exactly right.
So I think that about wraps it up for today.
Thanks, Tim. I appreciate the chance to be with you today.
And,
And I got all my steps in.
You got a lot of steps in today. So listen, everybody, thanks for joining us. Thanks for being on with us. Listen, stay strong, stay positive, and keep on moving. And I'll see you next time on Walkin' and Talkin' with Tim.
Bye.